Hello, my name is Trent and I'm a student physical therapist. Today I'm going to demonstrate how to prophylactically tape the ankle. The prophylactic taping of the ankle is used to prevent and support any new or reoccurrence of injury within the ankle. The most common type of injury in the athletic population for the ankle is an inversion ankle sprain. That's where the ankle is passively or during the competition pulled inward, which is inversion, which is stressing the ligaments on the outside of the ankle. The ATFL, anterior talar fibular ligament, is the most commonly injured ligament in the ankle. So during this taping, the patient is instructed to dorsiflex to neutral and apply slight bit of eversion to maintain that neutral position during taping. Pressure can also be given in this position to maintain that area. Prior to taping, you need to make sure that this patient is appropriate for taping in the first place. You can observe the skin, make sure there's good circulation by checking the nails to make sure there's no abrasions or other injuries to the ankle that taping would cause more injury. The first step after looking at the ankle, making sure it's appropriate for taping, is you want to apply pre-wrap spray to the ankle. Pre-wrap spray or the adhesive spray makes it better for the pre-wrap to stick to the ankle. It also acts as a barrier. If someone is more allergic to the adhesive on the tape, this acts as an additional barrier to the pre-wrap. So you can state to the patient, today I'm going to tape your ankle to prevent further injury to the lateral aspect of your ankle. So I'm going to tape it in a systematic and specific manner so that your ankle does not roll in any more than needed to, or any more than wanted to cause further injury to your ankle on this lateral aspect. So first you give just a gentle spray, thin layer of spray to the aspects of the foot that you want to tape. After the foot is covered, you want to wait for it to dry. You want to have the patient positioned in a position of comfort. Here, Devin is in long sitting with the area of the foot that I want to tape off the side of the table. You can palpate and have him press against you to feel where his gastrocs end, so you know where to start your taping. And Devin's gastroc is ending just proximal to where he is off. Next, you apply the pre-wrap to the ankle. You apply the heel and lace pads to the ankle next. These are applied over the extensor hallucis longus. So you ask the patient to extend the big toe, and you will see where that tendon raises up underneath the skin, and then also along the Achilles. These are used to help reduce any friction and abrasion that the tape may cause during athletic play. The pre-wrap is then laid down. As to cover the skin from any of the adhesive tape laid down. For Devin, I did not have him shave any areas of his skin beforehand. If you deem it necessary, you can have the patient shave prior to application of the tape. So once the pre-wrap is laid down, you will then start off with the proximal anchors. For this technique, I will be using 3 ankles at the proximal portion. Again, you want to put them in a position as to not be over the top of the gastroc muscle belly. But the first anchor I'm going to place down is just going to be 1/4 of an inch over the pre-wrap onto the skin. The reason I'm putting it onto the skin is that during sweating and perspiration during the exercise that he will be performing, that we don't want the tape support to be sliding down his ankle. And because these are just anchors, you just gently apply these. And you're not forcefully putting them on. Once the proximal anchors are placed, I'm going to place 2 distal anchors, again overlapping just slightly onto the skin. Again, the patient needs to maintain that dorsiflexion and everted position. Once the anchors are placed, you will then move on to the stirrups. The stirrups for an eversion sprain will start on the medial aspect of the leg, and you'll apply them first to the proximal anchors, and I will be moving directly over the top of the medial malleolus, underneath the leg, and up to the lateral aspect of Devin's foot. Again, it is important to maintain and to pull the tape as you bring it around into that eversion moment. Next, I'm going to place an anchor just posterior to that first stirrup that I placed. And this one will move just medially, anterior to that medial malleolus as it moves. And last, I'm going to place this last stirrup just more ventral, moving more posterior as we move around the ankle. Once you have your stirrups, I place 3 horseshoes at the back, moving across the Achilles tendon onto the anterior aspect of the foot. Once the horseshoes are complete, you will finish up covering all the pre-wrap with more just overlaps starting from the most proximal portion down. You want to overlap the anchors about 50% as you move down. One note that I did not make earlier, when you are taping the bottom anchors, you want to make sure you're off the proximal head of the stirrups, you're off the proximal end of the fifth metatarsal. There is the peroneal nerve that runs over the top. You don't want to compress this nerve because then you could cause some nerve irritation during the tape. So this lateral, or this most distal tape, I want to move back just about a 1/4 inch, just so you don't irritate that nerve. Okay, now that we have buttoned up the rest, and so that no pre-wrap is showing there, now we're going to work on the figure 8. You'll start on top of the foot. You'll go around. In each direction. Now you will work on the heel locks. Lateral heel lock, you will start on the top of the foot, place the anchor down. As you pull down, you'll wrap around the lateral aspect of the heel, go around the Achilles, up and over, and finish on top of the foot. The medial heel lock you'll just do in the opposite manner. Start on the top of the foot, pull down, pull down, around the back of the heel, and then over across the top. From this point, you can finish up by applying any more cover up to make sure you close up everything, and this is also a way to make sure that the tape stays on better, just so you don't have any loose edges. Again, staying off the fifth met head as you're applying the cover up. And that is how you prophylactically tape the ankle. Devin, how does that feel?
Feels pretty good, Trent.